A few months ago, I gave a talk, What's a Food Industry to Do, in regard to how they might improve public health. Today, I want to talk about what public health might do. And I'm going to start with the adage, a bird in the hand is worth two in the bush. Here, we're talking in a sense about customers. Working with existing customers is always wiser than trying to get new ones. Our existing customers in public health are the folks whose lives and passions fall in public health, where their job is to preserve and protect it. Whereas those birds in the bush, well, maybe they're the food industry, where their real job is to sell food. And so the first thing I think public health could do is stop inviting the birds in the bush to the table. This blurry photograph was taken of a by-invitation-only gala affair in 2006 launching the revision of Canada's Food Guide. And, I appreciate that 1/3 of the folks here are from industry, and I appreciate that, like Health Canada says, they are stakeholders. But they're stakeholders only in that whatever the Food Guide recommends will impact upon the sales of their products. I don't think they should be stakeholders who get invited to the table. And yet, all the way up the ladder of consultative processes for the Food Guide, the food industry was there, including in the 12-member advisory board. One member represented the BC Dairy Foundation, a nonprofit whose mandate was increasing consumption of milk, and whose homepage at the time said, "Don't tell mom, but chocolate milk is good for you." Someone who represented oilseed growers, who put out a press release even before they sat down at the table suggesting his mandate was to improve and increase Canadian consumption of oils. And then there was someone who was the Director of Regulatory Affairs for the Food and Consumer Products of Canada, who represented a vast array of companies, including Frito-Lay and Coca-Cola. And I guess what I'm saying is that public health could stop caring about Frito-Lay's interest being represented at the table. And so did these folks have an impact? Who knows? I do know, however, that the Food Guide suggests milk chocolate, or in this case, chocolate milk, is a milk alternative, which I'm sure pleased the BC Dairy Federation, and it definitely affected marketing. This advertisement came out shortly after the Food Guide was released, targeting parents of clearly young children. 2 glasses today because they'll need it tomorrow. Canada's Food Guide to Healthy Eating recommends kids get at least 2 servings of chocolate milk every single day, despite the fact that chocolate milk has double the calories and 20% more sugar than Coca-Cola. I imagine the food and consumer product manufacturers of Canada were happy to hear that juice, according to Canada's Food Guide, is a fruit, that there are equivalents between cooked green leafy vegetables and a half a cup of juice. This despite the fact that Canadian Pediatric Society, the American Academy of Pediatrics, both suggest limits to juice consumption, half a cup for young kids and a cup for everybody else, mainly because juice, drop per drop, has as many or more calories and sugar than Coca-Cola. And the marketers, again, did not miss this for a beat. Here are advertisements for orange juice and grape juice, both of which suggest explicitly that they are giving your kids 2 servings of fruit with every glass. The grape juice goes further and says no added sugar ever, which is a darn good thing because there's already 10 teaspoons of it per glass, double the amount of sugar in an equivalently sized glass of Coca-Cola. So public health could stop inviting the food industry to the table, but we haven't. Here is the Ontario Healthy Kids Panel release from the Food and Consumer Products of Canada. Those same folks who were at the table for the Food Guide are at the table for our efforts here in Ontario to address childhood obesity. I testified at this panel, and of the members of the panel, the only one furiously scribbling notes was Ms. Tanaka, who represents those folks, including Frito-Lay and Coca-Cola. And I don't think she's a bad lady. I don't think she's a bad person. She's doing her job. Her job is to represent the folks who sell food. And because I was saying things that might not have been kind to the folks who sell food in terms of childhood obesity, she was taking notes to bring back to her home base. She should not have been invited to the table. How about schools? I think schools are an arm of public health, and yet schools are making money by selling pizza and eating at Boston Pizza in this particular ad's copy. And Domino's too. It's dough raising night, where if you buy pizza and eat fast food pizza, you raise money for your schools. I think we public health folks could perhaps try harder to put a stop to this sort of collaboration. But it's not just schools, it's hospitals. And it's not just hospitals, it's children's hospitals. This campaign seems to occur every single year. Slices for Smiles. You can buy fast food pizza and donate a portion of the proceeds to children's hospitals. Should we really, as public health institutions and organizations and foundations, be selling pizza to fund our endeavors? I appreciate money's tight, but if we're going to complain about marketing to kids, this is marketing to kids. It's not just pizzas as far as this particular campaign goes. This was onion rings too. And when I wrote to the chair of the foundation complaining that onion rings probably shouldn't be sold in support of the Sick Kids Foundation, I got a note back saying that because the corporate sponsors offer a wide range of food and beverage choices, including low-fat options, it was okay. The cigarette companies make a lot of products other than cigarettes. Maybe we should work with them too. Somehow I don't think so. Here's Canada's nonprofit Breakfast for Learning, promoting breakfast, a great thing for kids across the country. But of course, they're also promoting Nutella. Nutella, in case you don't know, is a poor choice when compared to chocolate frosting, where the chocolate frosting has 25% fewer calories and 27% less sugar than Nutella. And yet, we have a nonprofit involved in health marketing this to parents of young children and to the children in their schools as a healthful choice. We need not do that. These vending machines are at my local sporting arena. Again, a publicly funded arena. There's 19 machines. I counted them in total. These are some of them as well. I think we in public health could probably work harder to put a stop to their existence in our institutions, our publicly funded institutions. Institutions that can take stands. That same institution that has all those vending machines does not allow perfume. We can take a stand. Public health should take a stand. And what about the schools again as far as school lunch programs goes? Here's Pizza Pizza's press release in 2010 saying it complies with our new Ontario government school food policy. I remember I wrote a blog post at the time that your school food policy sucks when the pizza companies immediately respond with a approved for pizza. We shouldn't be selling fast food pizza in our schools, and we in public health, I think, could make more stink about things like that. And we shouldn't be pretending that junk food is healthy. That baked potato chip bag on the right-hand side has replaced the non-baked one on the left-hand side because it is baked and has marginally fewer calories and marginally less sodium, but it is still junk food, yet now we're marketing it to kids and suggesting to them that it's healthy. It's in the vending machines in the schools. Public health should not be condoning that. They also shouldn't be condoning this sort of menu. This was at a city-run camp. Hot dogs, potato chips and juice on Tuesday, pizza, cookies and juice on Wednesday, chicken sliders, cookies and juice on Thursdays, fries, freezies and juice on Friday. This is not healthy food. And somewhere along the way, there's a health department who might be able to make some noise and try to put a stop to this, because presumably the camp is not like the food industry. They're not trying to make money off of this. They're just trying to get by. There must be a better way. We need to try to find a better way. This advertisement, it was taken by Dr. Dan Flanders. He photographed this in North York General Hospital. It also existed in Sick Kids Hospital, marketing pizza to parents and kids, of course, and potato chips, it would seem, given the display. And the marketing is you get a movie pass if you buy the pizza. He complained and they took it down, which is terrific. But how did it get there in the first place? Well, maybe it's because the food in the hospitals isn't much better. This is hospital food in a kid's hospital. We in public health should demand better than this. Hospitals are on our team. They are our customers. And what about grape juice? The Ontario Medical Association suggests that we should do something about grape juice. I know we talked about it before, having a lot of sugar, but here the OMA is suggesting that it needs a warning label. And in the United States, the Center for Science and the Public Interest is suggesting that there should be a lawsuit. In fact, they're launching a lawsuit against Welch's for making heart-healthy claims. There is a label on our Welch's here in Canada. It's a health check label from the Heart and Stroke Foundation. You'll find that label on slush puppies as well. And on candy. This is candy. And this is candy that is telling parents and children that it's fruit Candy is not fruit. Looking at that product on the left, there's double the sugar of the same weight of berries, 10 times the sugar of actual apples, and more sugar than Twizzlers. This is a horrible choice to give to your children on a regular basis, but it is even more horrible to suggest to them that it is a healthful choice, and that is precisely what the health check does. Studies on health check say 8 in 10 consumers trust health check because it comes from the Heart and Stroke Foundation. Near 70% agreed with the statement that they can rely on health check to help me make healthy food choices. Public health folks, like the folks at the Heart and Stroke Foundation, and there are great folks there, should not be calling candy fruit. This does not help our children. This does not help. Looking at the Heart and Stroke Foundation, what also I think does not help is suggesting that eating out can be done healthfully. Once upon a time, we ate out for occasions. Now we eat out because it's Tuesday. There's a problem with spending our money in restaurants. The problem is that there are very poor quality choices there, and even with programs like Health Check, there is no guarantee that those will be the only products purchased. We've got Health Check at pizza places. We've got Health Check at Extreme Pita. Again, telling parents that you can not bother transforming whole fresh ingredients into foods. You can just take your kids to Extreme Pita and get them a healthy meal. Or to Harvey's. And kids are being told to do that too. This coupon was given out to elementary school kids who did a jump rope for the Heart and Stroke Foundation program, steering them to go to Boston Pizza with their parents, take $5 off a purchase. But you know what? There aren't any Health Check Kids meals at Boston Pizza or at any of the other places. Casey's has a Health Check program as well, not for the kids menu, but for the adult menu. But let's say you're an adult who decides you want to go there and you think it's okay to go there because the Heart and Stroke Foundation says there's healthy choices there. Well, your kids aren't going to get one, even if they order the vegetable stir fry with milk. And really, is there a kid on the planet looking at this kid's menu who's going to order the vegetable stir fry and milk? But let's say some kid does. That kid will still get a half a day's worth of calories and 2/3 of a day of sodium, 783 calories, 735 milligrams of sodium, and that is without a side dish. And that is without the consideration that they might order something less healthful. And as you might imagine, the rest of the stuff on that menu is pretty awful. At the end of the day, public health can stop suggesting to people that there are shortcuts to health, that eating out is a healthful behavior. We need to get people back into their kitchens. And ultimately, I think we can boil this all down to we need to untangle ourselves from the food industry and from the messaging that they've given us. It's the food industry who's taught us that less bad is the same thing as good. Less bad is not the same thing as good. It's just ever so slightly less bad. But that's been lost upon us. We need to untangle this mess. There are amazingly wonderful people in all of these organizations and institutions who care a huge amount about health and about children. I think we've just got confused. When I put this talk together, I called it Glass Houses, and I was going to suggest that people on glass houses shouldn't throw stones. We should clean up our house first. And while I think that's true, I've changed my thinking a little bit. I think instead we should throw a lot of stones. We need to break down our house. Our house is built on some really shoddy foundation. Public health needs to change the way it's approaching food. It needs to change the way it's approaching collaboration so that we can make strong moves like truly healthy school food policies, like championing healthy hospital foods, like disengaging from the food industry so that we don't market junk food and sell it on the backs of our kids to make profits for institutions, and where we don't steer people into believing that candies and juice are fruit. We can fix this. There are good people. And before we turn our sights on the food industry and really get ourselves all up in arms about the ads that are preying on our children, we should take a good look around. We should throw some stones. They don't have to be mean-spirited stones, but they need to be thrown. We need to tear this house down. Thank you very much.